Hello, this presentation will discuss tetracyclines, macrolides, and tetras tetracyclines. There are four members of the tetracycline family for systemic therapy. One, one member is tetracycline, which is unique in that the class and the drug have the same name. Demeclocycline, doxycycline, and minocycline. Tetracycline is a broad-spectrum antibiotic that inhibits protein synthesis. But since it's one of the older antibiotics, there is increasing bacterial resistance. It is used in the treatment of acne, peptic ulcer disease, periodontal disease, rheumatoid arthritis. It's also used with Lyme, anthrax, and with some of the preparations where you're using 3 to 4 drugs for H. pylori. In the absorption of tetracyclines, you have to be careful with calcium supplements and milk products, iron products, laxatives, and most antacids, as they will decrease the absorption of the tetracycline. What are some of the adverse effects? You can have GI irritation. You can have effect on the bones and the teeth. So tetracycline now is normally not used in children. There can be teeth staining that was evident. It can cause superinfections, hepatotoxicity, renal toxicity, photosensitivity can also be possible. So what are some of the major precautions? Tetracycline and demeclocycline are eliminated primarily in the urine, and they can accumulate in those with kidney disease, so this would not be your first choice for a patient in chronic renal failure. Tetracyclines can cause discoloration of the teeth, as I said earlier, so we would not want to use it in children. Diarrhea can cause a potentially life-threatening superinfection in the bowel, so you want to be careful with that. So you're looking at primarily C. difficile, and high-dose IV has been associated with severe liver damage. You also want to watch the drug and food interactions, and I already mentioned earlier that you have to watch the milk, the calcium, iron, magnesium containing laxatives, and most antacids, because it will decrease effectiveness. Now we're on to the macrolides, and that's erythromycin and also azithromycin. Macrolides are broad-spectrum antibiotics also. They work by inhibiting the protein synthesis. They are usually bacteriostatic, but they can be bactericidal. And they are very helpful if the patient has an allergic reaction to penicillin, and then potentially, of course, could have that cross-sensitivity to cephalosporins. So this can be an option for those patients when a penicillin would have been the first-line treatment. They are active against most gram-positive and some gram-negative organisms, and we do use them in community-acquired infections also. So their therapeutic uses are listed here. We do use it widely with chlamydia infections. It's a powder drink that is taken, and we do want to watch for the GI effects that could happen. QT prolongation is one that should be watched for, especially when this macrolide is combined with another medication that can prolong the QT interval. You could have a severe reaction or even sudden cardiac death. You do watch for superinfections, thrombophlebitis from injectable forms, and there can be transit hearing loss. Other macrolides that are there besides erythromycin, like I said earlier, was the azithromycin, which is commonly called the Z-Pack. That's given, you do a loading dose, you do 2 tablets the first day with 1 tablet for the next 4 days. This is only given for a 5-day total, but the serum concentration of the med and the half-life, uh, it really tends to act like a 10-day medication in that respect. But you do also with that have to watch for the QT interval issue. The other medication is Biaxin. Um, it was very popular before the advent of the azithromycin. So clarithromycin was very popular then. It is still used in some of the preparations for H. pylori as one of the antibiotics that is used, um, but you don't see it used as widely anymore. Another med here is clindamycin or Cleocin. It also inhibits protein synthesis, but it can promote severe C. difficile, which can be fatal, as with the other medications we just discussed. It's active against most anaerobic bacteria, gram-negative and gram-positive, and is indicated for only certain anaerobic um, infections outside of the CNS. And it can also be used as an alternative to penicillins. And we do use that, especially with some infections, because of that potential use if they're allergic to the penicillins. It is also has been used with some forms, severe forms of acne, and it's been used in for that. There's also a topical form that's used of the Cleocin T gel. What are the adverse effects we talked about? Same as with the initial macrolides we talked about, erythromycin. And we also have the Tigicil, which is also a broad spectrum, but it's associated with increased mortality, so you won't see that when used. We do have 2 topical forms, the mupirocin, which is used for impetigo, and also for MRSA in the nostrils. And when you guys get into practice, you're going to be using a lot of, it's called Bactroban, it's a trade name. You'll use a lot of that for impetigo on the children that they get on their lip or around the nostrils. And that's just a brief look at the macrolides. So the first question here is, the patient is prescribed doxycycline. If they complain about gastric irritation, what should you do? And the answer is C, give the patient food, because if you give them milk or antacids, it will reduce the efficacy of the medication, and there's no need to stop the medication unless the GI irritation is not tolerable by the patient. Question 2, after administering erythromycin for upper respiratory infection, it is important for the nurse to determine if the patient is also prescribed which medication. And the answer here is D, which would be verapamil. And that's because it also affects the QT interval. So this would be a question that you could look up all of those medications to see if they're listed as a drug interaction med with erythromycin, or if you would know already that it causes QT interval. That's something important as a prescriber that you're going to have to learn to do, is to make sure that meds that you're giving or that meds that their patients already taking will not cause any further harm to the patient. If you're not sure of an interaction, you can always check with one of your pharmacists at one of your local pharmacies to have them look it up for you and let you know. That's always appropriate to do. The last question, which tetracycline may be administered with food? And the answer is minocycline. And that would be, again, something that you would pick up in your reading or in one of your drug references. And that's it for this presentation. Thank you.